Hello everyone, welcome to Talk with Us today. On today's episode, I'm going to be looking at a very significant topic. It is very important because it affects every one of us. In fact, in our lifetime, we have come across it in one way or the other. So today, we look at some facts about malaria. I know you're surprised, right? Yes, malaria is a very, very common disease in our society today. And therefore, there are some things that you need to know about this disease. But before we dive in, please if you are yet to subscribe to my channel, do so by clicking on the subscription button and post notification button. And if you have already done that, thank you so much. Malaria is an endemic disease that affects West African countries like Congo, Mozambique, Uganda, and Nigeria. Statistics has it that Nigeria has the highest percent, about 27% of cases of malaria. Malaria is a disease caused by Plasmodium parasite, which is transmitted by an infected mosquito bite. So right now, let's dive into some facts about malaria. Fact number one, not all mosquitoes cause malaria. Yes, you're surprised, right? Not all mosquitoes cause malaria. There are different types of mosquitoes. We have the Aedes mosquito, Culex mosquito, Asian tiger mosquito, and of course, the Anopheles mosquito, which causes malaria, especially the female. Fact number two, why female, not male? Is it that female mosquitoes are wicked? No. So what happens there is that female mosquitoes do not bite humans. Yes, they feed on fluid from plants like nectar. On the other hand, female mosquitoes need the blood gotten from sucking humans for reproduction. Fact number three, how does malaria occur? Why most people think that malaria is caused by mosquito bite, which is actually correct. But what the mosquito actually does is that it transmits the malaria parasite from an infected person to a non-infected person. When a female anopheles mosquito bites an infected person, that is somebody already infected with malaria parasite. So the mosquito sucks the individual's blood, and the saliva of the mosquito mixes with the blood of the individual. Therefore, the parasite is transmitted to the mosquito, and this parasite begins to multiply, but it doesn't cause harm to the mosquito. When this already infected mosquito bites a non-infected person, it passes the parasite from itself to the non-infected person. So this malaria parasite, which is the plasmodium parasite, travels in this person's bloodstream and then it attacks the liver first. So after attacking the liver, it then goes to the red blood cells and begins to destroy the red blood cells. So having done that, this individual begins to manifest symptoms of malaria, which includes fever, headache, body weakness, and pain. Fact number four, can malaria be life-threatening? Of course, malaria can be life-threatening, despite the fact that it's a very common disease in our society. It can lead to life-threatening symptoms because it attacks the red blood cells in the body, which play an important role in oxygen and nutrient delivery throughout the body. Aside the usual symptoms of malaria, which we are all familiar with, destruction of these red blood cells can lead to more severe symptoms if the disease is not properly taken care of. It can lead to symptoms like impaired consciousness, convulsion, jaundice, and dark urine. Fact number five, malaria and genotype. People with genotype AA are more susceptible to having malaria. Some people say that it's because their blood is more delicious. This isn't true. The red blood cell contains a compound known as hemoglobin, which is solely responsible for oxygen delivery around the body. In people with genotype AA, their hemoglobin delivers oxygen around the body more effectively compared to other genotypes. This allows the malaria parasite to be able to thrive better in their red blood cells compared to other genotypes, making them more susceptible to malaria. Fact number 6: malaria can be prevented by vaccination. The World Health Organization recommends a vaccine against the malaria parasite for children between the age of 5 months to 2 years. Other methods of preventing malaria includes sleeping under a mosquito-treated net, personal and environmental cleanliness like cleaning of the gutter and burying of broken bottles. Also, use of the mosquito repellent cream, wearing of protective clothes, and in case anyone in the family comes down with malaria, ensure that person sleeps under a mosquito treated net so that mosquito doesn't bite the person and transmit it to another person. At this point, I'm sure we gave one or two new things about malaria. Don't forget to like, comment, share, subscribe, and turn on the post notification button to meet again with your favorite nurse, Nurse K. Bye.